All right. Good afternoon. Good morning. Good evening, everyone, wherever you are, and welcome to UCSF Center for Global Nursing Impact Series. This series aims to provide a platform for nurses and global partners to share their remarkable work, offer valuable insights, and inspire our global community. Following the presentation, there will be a short Q&A, so feel free to leave questions throughout the presentation in the Q&A box on Zoom, and I'm happy to facilitate that at the end of the presentation. My name is Rebecca Silvers. I'm the director of UCSF Center for Global Nursing, and it is my pleasure this July to introduce this month's speakers. We have Miss Moomba Thornicroft and Dr. Charisse Ahmed, who are actually awarded the CGN 2025 and 2026 Global Nursing Research Seed Award to advance their church-based fellowship bench pilot, which focused on community engagement, HIV, and mental health interventions addressing sexual and gender-based violence among adolescents in Zambia. And you'll hear a lot more from them in just a minute. But just a brief introduction, Miss Moomba Thornicroft is the founder and executive director of A Place Called Home, a woman-led organization focused on the prevention and response to sexual violence against women and children. Moomba is a Zambian researcher, project manager, social justice practitioner with decades of experience working at the intersection of gender-based violence, mental health, faith engagement, and community development. She has led and supported the implementation of community-based research and interventions in partnership with local and international organizations with a focus on trauma-informed approaches, faith-based responses to violence, and adolescents' well-being. She serves in leadership roles within several community and professional networks and is involved in research exploring innovative approaches to violence prevention, mental health, and community-based care in Zambia. We also have Dr. Charisse Ahmed, who's here with us at UCSF. We are so lucky. She's an assistant professor at the UCSF School of Nursing. She's also a research fellow with the South African Institute for Policy and Research in Zambia and a faculty lecturer for our CGN Certificate in Global Nursing program. Dr. Ahmed's work focuses on advancing global health equity through research, policy, and nursing leadership. And in 2023, Dr. Ahmed co-founded Mind Changers Pals for Life, a grassroots mental health advocacy and research advisory group comprised of youth, clinicians, survivors, and community leaders. Through her work, she's helping to amplify community voices, strengthen mental health services, and advance equitable, local-driven approaches to health and well-being. We have so much to learn from these two, and I'm very honored to welcome Ms. Moomba and Dr. Ahmed to this month's Global Nursing Impact Series. I look forward to this presentation, and for now, I will hand it off to our amazing speakers. Thank you so much.
Thank you so much for the introduction. Moomba, I'll let you get started if you would like.
Yes. Thank you so much for that great introduction. It's always humbling to just hear me being introduced, and I'm like, oh, that is me. Yeah, so thank you so much, Rebecca. I will be sharing what we do at a place called Home-Ikhaya in partnership with UCSF, and we will also share a little bit about the Institute for Global Health Sciences and how we have partnered into doing some of the work that we are doing. I will be making this presentation on behalf of a place called Home-Ikhaya, and Dr. Charisse will be co-presenting with me. So thank you so much, everybody, for joining us today. I know there is stuff you could have been doing, but you chose to come and join and listen to us. A place called Home-Ikhaya was founded in 2025 at a time when none of us had an idea that we would be where we are or do what we are doing, but we were just happy helping out people and giving them support with their sexual violence and GBV cases. And we decided, why not get this formally registered so that we can offer help and be able to work in partnership with the government. And so a place called Home-Ikhaya was born. Ikhaya simply means home in one of our Zambian languages, Ngoni, and a South African language, Zulu. So it's basically a place called home. So our vision is we would like to see a Zambia where every child, every adolescent, and every young person does not live in fear of gender-based violence and that they grow up in a beautiful and safe environment. Our mission is to prevent, to identify, and respond to sexual and gender-based violence early enough. We want to be able to see these cases and prevent them before they can escalate. We also do research, advocacy, and we work in partnerships with other institutions and organizations, which you are going to see further in the presentation. So what do we do at Ikhaya? We have these 5 pillars, which are prevention, awareness, and response to sexual violence against children and women. And under the prevention arm, we work in schools where we talk to young people about sexual violence, how to prevent it, and the goal is just for them to be aware and know what to do when it happens to them or to their friend. We want them to understand the referral pathways that are available. And most importantly, we want them to know that they can be protected even when they do report this. We have the second pillar, which is the trauma-informed care or capacity building. Under this arm, we do trainings. We train community people. We call them gatekeepers, the community gatekeepers, and these include teachers, pastors, community leaders, civic leaders, teachers, healthcare officers, and some officers from the Department of Social Welfare, and any other stakeholder that we feel plays a role in the protection of children in the community. Which also brings in the community engagement arm, where we work with identified community members that are a part of a formal group, an interest group, which was created by Dr. Charisse. And we train them and they do the research work and the community mobilization and awareness programs with us. And we have the fourth pillar, which is research and evidence generation. In the last Global Nursing Seminar, Dr. Charisse spoke a little bit about the research work that we do and what we did with the grant seed, how all that came together in working in research and evidence generation. And we are still going to talk a little bit more about that today. And finally, we have an arm that deals with policy influence and system strengthening. This part always gets me excited because one of the hardest things in the work that we are doing was the fact that sexual offenses in Zambia were bailable offenses. Somebody could be arrested at 9 in the morning, and by 9:27 they are out on bail. And sometimes they will go missing, or the case would die a natural death because nobody can find them. But then we worked so hard. We campaigned, we advocated, we went live and spoke to the president. We did everything that we could to influence policy and ensure that sexual offenses in Zambia were no longer bailable. And guess what? This is now law. It was passed in Parliament and it is now official law, and it makes our work so much easier. There is so much that we want the government to change, but I think this was one of the greatest steps, and it really shows that the advocacy work that we do, tough as it may seem, is seen and that we are heard. Thank you. We'll go to the next slide, please. So this is the team lead for Ikhaya. These three are the people behind the work that we are doing. Of course, we do have a larger team that works on the ground, a larger team that does the research on the ground, community engagement, and the trainings and all that. But as the founder and executive director, I give strategic leadership to the organization. And we have Bristol, who is soon to be a PhD doctor. He is a biostatistician and data scientist. And then we have our very own Dr. Charisse Ahmed, who has for a long time offered her time and her work in ensuring that the research arm of Ikhaya is up and running, and she leads it so well. And we are doing tremendous work under her leadership. So who do we serve? Who are the people that we serve? We are serving the children and adolescents, the women, families, faith leaders, teachers, health workers, community volunteers, and the government partners. These are the people that we offer our services to, the children in the schools and in the communities, the women, and these are not only women who are survivors of sexual violence or GBV, but these are also the mothers to children that have suffered violence. For instance, I would give an example. We have had a few cases where the survivor is a baby below the age of 5, and sometimes even below the age of 1, strange as that may sound. And in this instance, we are definitely not offering psychological support to the child, who has no idea what just happens to them. But we are working with the mother because it's the mother who needs the support, who needs the help, and she's the one who we are working with through the justice system and working with her through the healing path. So families also, they come to us, we go to them, others approach us because they would like to know how to move on as a family, even after what has happened. And we offer some trauma-informed care skills to them in order for them to be able to support their family members and to be able to support them even through the justice system and pathway, which could sometimes take years and can be very re-traumatizing. As said earlier, we do train faith leaders in trauma-informed response to survivors, health workers as well. We do receive referrals from health workers. These are doctors and nurses. When they receive these cases at the hospital, they know that Ikhaya is there to offer secondary support, and they call us to work with the victims. And obviously, the community volunteers. We can never do anything in the community without working with the community volunteers or the NHCs, the neighborhood health committee members. These are our ambassadors, so to speak. They live in the communities, they know the people, they are trusted by the people. So we work with them and we work through them, and some of them are actually a part of the community interest group that we have at a place called Home-Ikhaya. The government partners, these are the police, the justice system, and also the Department of Social Welfare. Ikhaya has built trust in the communities, through the work that we do. We have a lot of presence in the schools, in the health facilities, and in the churches. So in the schools, I could actually say there is not one school that we have visited to create awareness that we have not come back with cases. Every time we share our work, and we get even teachers who come to us and say, we suspect this child is going through this because we can see all the symptoms you were talking about. And through our awareness sessions, we have had a lot of cases that we have taken to the police, and a lot of cases that we have had to cancel. And this is the same for the health facilities, the churches, and other legal partners. So in this picture, I will go really quickly. You can see we have 2 policemen in our office. That's my office at Ikhaya. We were discussing how best to work together, especially with the referrals. Sometimes we have clients that are just scared to go to the police. Like the police is not one of the friendliest faces you get to encounter. So sometimes the clients would come and make reports here at Ikhaya, and we support them with the police reports and everything. Sometimes we actually do escorted referrals. So this was us here in the picture. Brainstorming on how to make this smooth transition and how we can work together without re-traumatizing the clients. This was a boarding school in the central part of the country where the school gave us a whole weekend to create awareness to the students on sexual violence. We spoke to over 1,000 girls in this school. And on the left, these are not doctors that you're seeing here. These are teachers in duster coats. We took this picture after we trained them in trauma-informed care and response. This was also in the central part of the country. And the picture on the right is me in Zimbabwe on Human Rights Day. I was giving a speech on children's rights. Um, the the picture in the center was me speaking to men because we believe that if we do not speak to men, we are not going to end sexual violence against women. This begins with them. So I was giving a presentation at a men's conference, and the two pictures in the sides was me speaking at churches. One was a youth conference, and the other was a youth camp. I was speaking at a book launch. Somebody wrote a book on childhood trauma, and I was the speaker at the book launch. And the one in a pink dress, I was speaking at a daughter and mother conference. That's why I was dressed in pink, just to. Yeah, okay. So I kept referring to this community interest group that Ikhaya founded through the support of Dr. Charisse. We call it Mind Changers Pulse for Life, MCP4L. This team brings together researchers, community members, and people with lived experiences, and service providers also. This is the group, like I said, that we use for the research and to improve mental health and awareness in the communities and in the schools. Those are our group meetings and team building. Mhm. So what is the impact of the work that we are doing? We believe that the impact is not only about how many people, but we believe that our impact shows in how the community also responds to us. The community has got trust in us, and the confidence that they have built in us is what we see that we have an impact. When community people can call us, ask us to intervene, ask us to speak on their behalf, then we know that the work that we do has got an impact. When we get a family member, a mother or a survivor that we supported, and they are able to share the work that we do, to share that they know an organization that can speak for them, they know a place where cases can be reported and they will not be judged. They will not be asked, why were you out at this time? What were you wearing? They are not going to blame the victim that this happened to them. And when this word is shared by word of mouth, then we know that there's something we are doing right. And our impact has been in knowing that we are helping build communities where children are protected and survivors are believed and justice is possible. So in this impact, we have supported over 40 cases through the court, and we have secured 9 convictions. Now, this 9 convictions is no small achievement because, like I mentioned, sexual violence um, was a bailable offense. And if I could loosely say, it has never really been taken as seriously as other offenses like physical assault or theft and things like that. It has just been looked at as one of those offenses. Just go home and talk about it. Maybe he can pay you, the family can pay the other family and whatnot. So for us to go from receiving a report, taking it to the police, ensuring that somehow this file does not go missing at the police and it makes it to the court, and through all the adjournments and supporting the survivors to give testimony and to achieve 1 conviction, it is really a huge outcome for us. And we so far have 9, and we have 7 other cases currently in the court, one involving a male child who was sexually assaulted by a neighbor. And we have also taken back 7 survivors to schools, and we have placed over 15 girls in safe houses. At this point, I think I should just mention that it is our goal to have a safe house where we can house these children, especially those that are being sexually assaulted in their homes. But right now, we are working with others in partnerships with other safe houses where we have to take our survivors to. We encounter quite a number of challenges, and one of them is the child-friendly justice systems in the way they question the children, and the barriers in reporting, limited safe housing, and limited resources for holistic care. What are we doing for sustainability? Like we all know, the funding space has really shrunk, and we don't have so much donors currently funding programs like ours. So Dr. Charisse and I brainstormed, and we decided that we could start some farming for sustainability. And we currently have a pig farm, and we are moving on to having vegetables in the next week or two. And we are hoping that the resources would be going to saving that one child that comes. We always like to say at Ikaya that we can't change the world, but we can change the world of one child. So we have 2 mommy pigs. That's the farm that we have started. Okay, you can.
Thank you, Moomba, for that wonderful presentation. I just wanted to jump in and transition the conversation very quickly because I know that we're short on time, and just share my experience partnering with Ikaya over the past 2 to 3 years, which has been an amazing experience for me. And so I want to talk about my role as a nurse scientist and supporting Ikaya by specifically emphasizing the unique role of nursing as a whole within this partnership. So, as you know, Ikaya leads important community programs to prevent and respond to gender-based violence and sexual violence. And nursing brings a really unique lens and perspective that integrates clinical care, public health, and community engagement all at once. So, through my partnership with Ikaya, I contribute by co-developing research with the community, co-designing trauma-informed interventions with the community, strengthening implementation strategies that connect health and community services, building local capacity, and translating research into sustainable practice and policy. So, this is an example of nursing extending beyond the hospital into communities to address the social and structural factors that influence health. So, Moomba mentioned our interest group, MCP4L, which is the community-based research arm of Ikaya. So in 2003, I partnered with local Zambians, including Moomba, to establish MCP4L as a community-based response to reduce mental health stigma, increase mental health awareness and health seeking, and engage communities as active partners in mental health research. So this partnership has since grown into our current work where we as a team co-designed a church-based trauma-informed mental health intervention that transforms churches into safe spaces where adolescent girls and young women with histories of sexual and or gender-based violence can receive mental health support delivered by their peers or lay counselors. So the photo on the left is just a picture of me presenting to the MCP4L team in our t-shirts. And on the right is a picture of just a few of our trained lay counselors who are now implementing the intervention within church settings in Lusaka. And this is just a diagram that summarizes the design of our randomized control trial, which is evaluating our church-based intervention, which MCP4L decided to name Impatayatu, which means our space in Nyanja. And participants are basically recruited from the community, screened for eligibility, and then they're randomized to either receive the intervention immediately or after a 3-month waitlist period. So we chose this population because a lot of the work that I do is around HIV, and sexual and gender-based violence is a major driver of HIV vulnerability among adolescent girls and young women in Zambia. So, with the support from CGN and other grant funding, we are currently evaluating our church-based intervention through a randomized controlled trial in Lusaka, as you saw in my previous slide. And on the right, is a picture of our recruitment flyer that we use to increase awareness about our study. So we have been supported by multiple funding sources, and their investment really helped us address violence within the community through research while also building the capacity and sustainability of Ikaya's community work. So, our partnership has produced a few outputs, including a national policy brief on strengthening Zambia's mental health system, and our study protocol for our current trial is published in Trials. And these publications really reflect our commitment to translating community partnerships into evidence that can inform policy and practice. And looking ahead, we are actively preparing additional manuscripts from our current trial. Also, I'm really excited about this. In October, we as a team will present our preliminary findings from our randomized trial at the Sexual Violence Research Initiative, or SVRI Forum, which is one of the world's leading conferences dedicated to research and practice on preventing and responding to sexual violence. And all three members of Ikaya's leadership, so that's Momba, me, and Bristol, our biostatistician who also joined us today, we all had abstracts accepted for presentation, which really reflects the strength of our collaborative partnership in growing research capacity. Momba was recently selected to participate in the SVRI Faith and Gender-Based Violence Community of Practice Lab. And what she's doing is documenting, excuse me, practice-based knowledge from our WHO-funded work, which involved training church leaders in trauma-informed care for survivors of sexual violence. And she is developing a practice-based learning brief that will help share lessons from Zambia with practitioners working in similar contexts around the world. And then I'll turn it back over to Momba.
Thank you so much, Dr. Charisse. So, the call to action, we just want that no child should suffer in silence. We want to strengthen the people that survivors trust first. We want to make trauma-informed care the standard and not an exception. Every survivor deserves to be heard, believed, protected, and supported without fear of further harm. And we would like to invest in sustainable community-led solutions. And we would like you to be a part of what we do. Thank you so much. Twalumba Zikomo. Thank you.
Thank you both so much for this incredible presentation. I'm sitting here with so many ideas of um, kind of reflecting about your leadership and how incredible the work that you're doing is creating impact, not just, as Moomba said, um, through numbers, but also through changing culture and bringing safety and security to this population in Zambia. I know that there's one quick question in the chat about police workers in your community. Are there female ones, or is it only a male population in Zambia?
So it was, let me just look at the question. What that, would you read the question again? Do we have female police officers as well?
Yeah,
Yes, we do have female and male police officers, and both genders deal with sexual violence cases against children.
amazing. Thank you. And my question I just wanted to know more about was Zambia, from what I know, has a population of like 22 million. And you guys are doing this incredible work. Is there more organizations though? Because how could you reach all 22 million? Like, are there other people that you're partnering with doing similar work? Are you a model for other organizations to build and to grow? Because my sense is that the need is great and the work you're doing is creating impact. And how do you grow that, or what else is going on in this space? And really excited to see this work.
Yes, the need is great. The need is really huge, and sometimes we feel so small to do the work that we should be doing. And this is why we always say we can't change the world, but we are going to change the world of one child. But this is where our capacity building comes in. We are creating ambassadors throughout the communities, throughout the towns. When we visit different towns, we ensure that we train a number of people that are able to do the work that we are doing. They may not be able to do how we do it, but they are there to look out for the cases. Ask us, we have this, how do we do it? And we've been working remotely with a lot of community people that are based outside Lusaka. When we can't reach them, we give them guidance and we get reports. Oh, thank you. This person has now been arrested. Thank you. We managed to rescue this girl child. So we are a model organization, and we are hoping that if we do get funding, we can go all out and train enough people in each province.
I believe it has to happen. And I love Charisse, Dr. Ahmed, your comments about, nursing and the impact it makes in the collaboration with community partnership. And I think what makes this presentation so amazing is you have community partnership and nursing, and then you have the data of what you're doing and you're researching it so that we can all learn from the incredible work that you're doing. And I love that idea that in global health in health in any country around the world, how we progress and how we learn is through partnership and together. And I think you guys are such an example of your three leaders kind of bringing all their expertise together to do the work, show the impact. With a small team, you can really do such incredible things for the community. And we're honored to have you here today. And given the time, I want to wrap up. I let me see if there's two more questions. Or one is a comment from Dr. Rankin. I work in Malawi and know that the suicide rate is rising. Is there the same rise happening in Zambia?
Yes, it is the same. And I think the Malawi and Zambia have generally got the same the same statistics, the same environment and everything. So we do have the same here.
And E has commented, such amazing work advocating for policy change. Can you speak more about how you were able to advocate and lobby to change the bail law by appealing to Parliament?
Yes. So we do what we call submissions to Parliament. We write to Parliament when they are debating laws. We go there, we make a presentation. Sometimes we just write to them and say, this is what we want to see. We have meetings with the civic leaders, that is the area member of Parliament, and we tell them this is what is happening. Look at the statistics in your constituency,
Mhm.
and this is what we would like you to do in Parliament. And sometimes we use social media as well. We go live on social media and we address the president. And for us, because in the next 1 month, on the 11th, on the 13th of August, we are going to the polls, we'll be voting. So a few months before campaign period is really a great period to push your agenda. And we took advantage of that because the government wants to show that they are listening government. When people do ask for things, they do them. So we also took advantage of the period in the country to say we had meetings with the Ministry of Justice. We marched, we walked, we cried, we carried placards, we did everything to ensure that we were heard. And we did not do this alone as Ikaya, but we teamed up with other organizations, picked a day, and we painted the streets black and we ensured that we were heard.
Well, on behalf
Yeah.
of all of us at UCSF and Center for Global Nursing, we're so honored that we got to be a small part of this by helping fund through the SEED Award last year, and wish you guys all the success as you continue to do this incredible work. And we hope to stay very much connected. And when your papers come out and other things, we'd love to share them with our community, and are just so grateful that you presented for all of us today. So thank you kindly for joining. On our website, we'll also put, I think do you guys have a website? We'll put contact information for the organization, so that you can reach out if you have questions. For Moomba or for Dr. Ahmed. We're happy to put people in touch if you're interested in partnering and joining with them in their incredible work. So thank you all for joining us today, and we hope everyone enjoys the rest of their day, evening, morning, wherever you are. So thank you guys.
Thank you for having us. Bye.
Bye.